Hello, good morning. I am Dr. Saumitra Ray, ex-professor at Vivekananda Institute of Medical Science and ex-vice president of Cardiological Society of India. It's a very heartening experience to attend this National Intervention Council midterm meeting at Ahmedabad today. I just chaired a session on antiplatelet therapy at the length and breadth of coronary artery disease, along with certain high-risk population subsets as well. What transpired and re-emphasized by the national and international speakers was that it is a highly individualized territory and it's very difficult to follow the guideline because guidelines always get out of date because the knowledge is exploding like anything every day and newer evidences are pouring in like anything. So we have to, as much as possible, adapt with the newer science and newer concept. But what transpires is that it's ultimately a fine balancing act which is necessary on the part of the clinician because each and every patient is different as far as their need for anticoagulation or antiplatelet therapy is needed, whether it is single antiplatelet, dual antiplatelet, whether it is 1 month, 3 months, 6 months, 1 year or beyond that. And along with if there is a chance of anticoagulation going on in the patient for atrial fibrillation, then the situation becomes even more complicated. But what also appears is that the age-old aspirin is still not irrelevant as a single agent, as well as it's almost always a part of dual antiplatelet therapy. You can't think of any dual antiplatelet regime without aspirin. So aspirin is the constant factor. The second antiplatelet agent varies, and there you have got a wide choice, and that choice depends on the patient's thrombotic risk versus bleeding risk, whether the patient is having acute coronary syndrome or chronic coronary syndrome, and so many other considerations. So I think my message will be to keep yourself updated and abreast the newer evidences coming on, not every small trial, but the big important trial, and to follow the important national and international conferences on this, what new data have been published, and critically analyze them, and may go to the review articles from time to time to see the state of the art of management of antiplatelet therapy in coronary artery disease today. I stop over here. I hope you enjoyable rest of the NIC conference.